Baby Savers, a coalition of organizations and NGOs and others that provide an alternative to unsafe baby abandonment, have raised the alarm on government closures of their facilities. According to their own research, several thousand babies are abandoned annually in South Africa, and it's a situation that worsened during COVID. There are over 40 baby savers in the country, and between January and September this year, they say they've saved 50 babies, with over 80 given over to aligned organizations. Let's find out more with Dr. Whitney Rosenberg, Baby Savers South Africa co-founder. Dr. Rosenberg, good evening to you and welcome. I think for the benefit of those viewers who don't know much about the work that you and your network do, just quickly explain that to us.
Thank you, Iman, and thank you to your viewers. So Baby Savers South Africa is a national coalition of organizations that are registered with the Department of Social Development that have Baby Savers, a box in a wall installed, and there's an alarm attached to the box. So what happens is when a child is safely relinquished into the box, an alarm is triggered and a care worker on the other side collects the child. So we oversee these members. We help them to do things the right way, to have a social worker assigned to the child, a registered social worker, immediately when the child is received, and all the normal legislative processes are followed after a child is received inside a Baby Saver box.
There are these really heartbreaking stories, Dr. Rosenberg, behind what actually motivates a person to give over their child under those circumstances, and I would love for you to share just some of those stories with our audience.
So just to bring context, of the leading causes of abandonment, we're looking at gender-based violence. We're looking at teenage pregnancy. We know that both of those, South Africa has the highest in the world. We're looking at forced prostitution, rape. We're looking at poverty, the rates of poverty have gone up since COVID. So that's just putting you in the picture of what these desperate women go through when they relinquish or when they abandon their children unsafely.
You know, as you describe each of those categories, on their own, you can imagine the trauma, the lack of support. There must be a gigantic factor that motivates a woman to do that. We have seen, and you have some statistics around that, of babies who do not, or babies who won't make it to these Baby Saver boxes, how, oftentimes are forced to be abandoned in a field or, in some gully or ditch somewhere. Without these boxes, what would the reality be?
It would be a very sad reality for South Africa, and it's a sad reality that Gauteng is facing since DSD has decided to shut down Baby Savers. Basically, there's only one of two outcomes for a baby that does not have the option of a Baby Saver, either severe disability or death. And this is a very sad thing, especially for Gauteng at the moment, because these mothers have no other option. And we know several cases where mothers have approached social workers and social workers have not assisted them. They've been turned away from social workers. They've gone to police stations and police stations have not assisted them. They have asked nurses to help them and nurses have not helped them. So these mothers literally have no other option. Yeah. We also emphasize that a Baby Saver is a last resort. After pregnancy counseling has either failed or has been unavailable, then only should a Baby Saver come into play.
As you say, it literally is the last resort. I would love for you to perhaps tell us why this is happening, why they're being turned away from either healthcare or from law enforcement facilities. What are some of the stories that have been shared with you?
The stories that we've encountered is that these women have encountered a lot of prejudice. So they get judged by nurses, they get judged by social workers, police officers don't know what to do with the babies and also turn these women away. So on the ground, the reality is that is not working. This handover that the Department of Social Development has said is available to mothers is not actually available to mothers because it's not working, it is failing. We have countless examples of women that have approached social workers. One happened last year in East London. A woman approached a social worker. The social worker turned the woman away, and the very next day, a baby was found abandoned in a parking lot in KFC. We have another instance in Durban, and this is only some of the examples we have. In Durban, where a mother wrote a note and said, I've tried the police, I've tried the social workers, they failed me, and she left her baby abandoned in a field. So this is the reality, and I think what the department does not realize is that they are speaking about legislation that does not speak to what's happening in the South African context. Very importantly, baby savers is not something unique. It's not something new that we've invented. It's practiced all over the world, not only in first world countries, but in third world countries as well. Our neighbors, Namibia, implemented a safe haven law in 2019 after only 13 fetuses were found abandoned. We are looking at 13 minimum a month, of which we know of, and we have media reports to back that up. And this is only of what we know.
Dr. Rosenberg, thank you very much. I know this was a lightning fast interview, but you gave us so much information there. We really appreciate your time. There's a missing link, it would appear, in what you're describing, between the way the Department of Social Services is connecting with activism and communities on the ground and the realities around these options that they say are available, it actually not being viable alternatives for women to safely let go of their children. We will interrogate that perspective in just a moment with when Bongiwe interviews a representative from the department. That was Dr. Whitney Rosenberg, Baby Savers South Africa co-founder.